Bismillahirrahmanirrahim. So in this lecture we are going to study about the vascular ectasia. In the lecture before we have already studied about the hemangioma and the classification of vascular tumors. So in this lecture we are going to study about the vascular ectasia. So what is ectasia? Ectasia means dilation. And the vascular ectasia means the permanent dilation of the pre-existing small blood vessels, usually in the skin and mucous membrane, that forms red lesion. So it is not a true neoplasm, it is just the permanent dilation of the pre-existing lesions, resembling like a tumor. It also has three palms. The palm one is the Nevus Flammeus, the second one is the spider Telangiectasia, and the third one is the hereditary hemorrhagic Telangiectasia, also called as the Osler-Weber-Rendu disease. So talking about the first one, which is called the Nevus Flammeus, it is also called as the birthmark, or it is a birthmark. It is the most common palm, and it ranges in color from the light pink to deep purple, and it is a plate lesion. Ranging in color from light pink to deep purple. And the important point is that, like the papillary hemangioma, it also regresses spontaneously. One of the type of Nevus Flammeus is called the port wine stain, and it is special form of Nevus Flammeus because they don't regress with time. And it is mostly present in the region which is supplied by the trigeminal nerve. As you can see, this is a port wine stain or the Nevus Flammeus, which involve the region of trigeminal nerve. One which is called the spiral telangiectasia. So what is spiral telangiectasia? It is characterized by the radial rays of dilated subcutaneous. First one is the radial, second one is the subcutaneous arteries and arterioles, and the third important point is that they are pulsatile, and fourth important point that they are present around the central core that blanch with pressure. Characterized by the radial rays of dilated subcutaneous arteries and arterioles, which are mostly pulsatile, and they are present around the central core that blanch with pressure. As you can see in this picture, these are the radial rays of subcutaneous arteries and arterioles around a central core that blanch with pressure. They are mostly present on the face, neck and upper chest, and they are most associated with the hyperestrogenic state, like which occurs in the pregnant woman or in the liver cirrhosis. The liver cirrhosis because the blood does not reach the liver, or the liver is not functioning properly, so the estrogen is mostly metabolized in the liver, so it can lead to the hyperestrogenic state. You can see the real picture. This is the central core, and around which radial rays of arteries and arterioles are present, and this is called spider because this is the body of the spider. It resembles the spider. This is the body of the spider, and these are the legs of the spider. The third palm is called the hereditary hemorrhagic telangiectasia, or the Osler-Weber-Rendu disease. The first important point that it is an autosomal dominant. It is mainly due to the mutation in the gene of the transformational growth factor beta signaling pathway in the endothelial cells. The mutation in the gene of transformational growth factor signaling pathway in the endothelial cells, and it mostly occur in the skin, in oral mucosa, in the respiratory tract, in the GI tract, and the urinary tract. It can also easily ulcerate, causing epistaxis if it is present in the respiratory tract, GI bleeding if it is present in the GIT, or the hematuria if it is present in the urinary tract. We can see such kind of lesion in this disease. So that's all for today. Thank you. Jazakallah.